I'm a psychiatrist. I think when patients come in and they tell me that they're having a lot of problems and they're using a lot of marijuana, I might say like, well, maybe that's not really helping. And then for other conditions, we actually think there might be a benefit out there. We just don't know a lot. For 3,000 years, cannabis was a medicine. It was used for a variety of different conditions. And it was really like 100 years ago that it was taken off, largely for reasons that taken out of our pharmacopoeia for medicine. And we're now putting it back in. So our dark ages, and we're kind of emerging into this renaissance. I really do think that for all the questions that we've pondered today, science is this candle in the dark. And we need to kind of really reinforce the science so we can have a better understanding of cannabis and its constituents, so we can make the most educated decisions about how to use them. We know that there is some benefit out there. We've demonstrated that already. And we just need to then put it in context, just like we would do any other medicine. And then, the recreational side, I'll defer to others, but it's also an important consideration that we have to count.
Okay. Andrew, a final takeaway you want to leave us with today?
Yeah. When I was the director of marijuana coordination for the governor, one of the things I often had to say to our public health specialists is, for a while, some things need to just be good enough for government. I think there's a paralysis that is going around marijuana that until we know everything, we should govern nothing. And that's just not going to work here. So I hope that the public health specialists start to come through with frameworks both for recreational and for medicinal that we can use in the interim between when the science actually does catch up here.
Stacey, final thoughts you want to leave us with?
I couldn't echo these sentiments any more strong. I'll go on any more strongly. It's like rock and roll, right? In the old days, it's here to stay. It's not going anywhere. Patients and consumers are using it, and to wait until we have all of the information is just not logical or feasible. And our patients and our consumers deserve this data. And so what we need to do is whatever we have to do to get the science to be in an empirically sound place where we say we know this, we don't know this, but along the way we have to make choices that make good sense.
Okay, Bob, you get the final word here.
So on the CBD side, there's a need that the FDA recognizes exists. And then secondly, it has to deal with safety first. And it's not going to go away. When the Senate Majority Leader leads the bill through that has hemp, many of you may have thought he was interested in having rope sold in the United States, but that really wasn't it. This isn't going back, but all across stores in the United States, signs are out there, CBD. It's not going back. And so the question is whether or not there's an established role that if it's dangerous, we can pull it off the market. And as long as the FDA doesn't recognize it exists, it's just going to grow. You're not going to seize the military in the CVS and take the counters off. I'm sorry. I lived through this with dietary supplements. You didn't show me Ginseng worked. You try to take it off the market. So we really need to have safety protection and then the efficacy status. But the safety thing has to be there by the FDA. So if somebody gets hurt, we pull it off the market because that doesn't exist now.